Good afternoon and welcome to UnitedTV. My name is Kemal Erkan. Today is our clinical presentation for our wellness program, and Dr. Ripu Hundal and our good afternoon and welcome to UnitedTV. Sorry, that was me. And if you guys can turn your cameras on, Dr. Hundal, how are you doing?
That's good. Good afternoon.
We have our dietitians, Beth Wright, and our Director of Clinical Integration, Donna Gunkel, with us. And today we are going to talk about the importance of knowing your diabetes numbers. Dr. Hundal is the founder of First Aid Endo in Delaware. With his practice, there are several providers, and he is also the board member of our accountable care organization. So he is going to go over the education part of it on the medical management, and Beth is going to support us with the nutrition side of the management and understanding the diabetes numbers. So we can start.
Okay. Coming up okay?
Yep.
Great.
I think we'll go ahead and start with, or I can do this part of the introduction if you'd like for me to, Kemal. So again, my name is Donna Gunkel. I'm the Director of Clinical Integration. Dr. Hundal is our Director of our Diabetes Program. We're the only physician-led organization in Delaware with an accredited diabetes program. Caroline Weber is another one of our dietitians who helps run this program along with Beth and 3 other dietitians. And then we have 2 social workers who also support the program, Roxana Portlock and Carla Williams. And again, we have our diabetes program webinar the second Friday, usually of each month. And we do bring on a host of different providers to go over how those different specialties may interact with diabetes. So we've also had our cardiologist, nephrologist, podiatrist, and a host of others who join us on a regular basis. All right, so today we're going to hear from Dr. Hundal first and then from Beth. So I'll turn it over to you now, Dr. Hundal.
All right, thank you very much. All right, so today we decided to pick this topic like just an education point of view, like any person with diabetes or not, or any other person without diabetes also. Like this is a routine test which we do call the A1C, like what it means. So people should have a better understanding about this blood work test. And then if someone has been told by their providers to check their blood sugar, why is that important? Why should we do it? So that's the main topic for today. So if you can go to the next slide. So A1C, that is a very simple blood test. You go to the lab with a blood draw. It has to be collected in a special tube. And then the lab will run this assay and will give you a number which comes as percentage. So what does it mean really? A1C test, that tells us what's percentage of hemoglobin. Hemoglobin is a part of the red blood cell which carries oxygen throughout the body. So that's what we survive on. The oxygen is very important part, which without oxygen, obviously, no, we cannot survive. So the red blood cell has this protein which carries oxygen. So interesting thing is that this protein also can bind to the sugar. So the A1C is that what percentage of hemoglobin protein in your blood are actually coated with sugar. That is what A1C relates to. So it provides an information about average blood sugar reading over the last 3 months period. That's the average lifespan of a red blood cell. So obviously when the red blood cell is done with what it's supposed to do, it's usually disintegrated in the blood. Proteins are metabolized. So it lasts for usually the one red blood cell can function for 3 months period. So the A1C, that's what this came from, that it gives you an idea about blood sugar over the last 3 months. So the A1C is used to diagnose if someone has a normal blood sugar reading, or they are in the pre-diabetic range, or they by definition are classified as diabetes. So we'll go with the numbers in the next slide. So with the A1C, normal A1C, when you look at your blood test, it should be 5.6 and below, 5.6%. So if it's between 5.7 and 6.4, that is by definition is called pre-diabetes. And if the A1C is above 6.5, or the blood sugar is above 126, or A1C has been checked twice and it has come up as 6.5, then by definition, that is diabetes. So either it can be type 1, type 2, but again, by definition, that is diabetes. And in general, if somebody has diabetes, by American Diabetes Association guidelines, good control means A1C less than 7%. So that's what, if somebody has diabetes, that's what number they should remember and strive to keep their A1C below 7%. So A1C, as I mentioned, is dependent upon the red blood cells. So just imagine that there is some problem with the red blood cells for different reasons. Then if the red blood cell is not like living for 3 months, or is being destroyed quickly, or there is something else going in the body which impacts the half-life of red blood cell or the size of the red blood cell, that will have an impact on A1C. So this is a few conditions listed over here. Sickle cell disease, where the red blood cells gets destroyed very quickly. There is erythropoietin treatment. These are people with kidney problems. They are given erythropoietin to stimulate the bone marrow. So the young red blood cells count will be circulating in the blood, and that they won't be binding to the glucose levels that quickly. So it can falsely lower the A1C level. Patients on hemodialysis for their kidney disease, the A1C can be falsely on the low side. Then anybody receive blood cell transfusions. So if you're getting blood cell transfusion from a normal healthy person, they will have lower amount of glucose bind to the red blood cell count. So that won't give us the true picture. Same iron deficiency anemia, that will affect the red blood cells. Any person with liver disease, that can also have an impact on the A1C, about the protein, where the protein is synthesized. Thalassemia is another condition where they have problems with their red blood cells, and they are anemic. So those A1C may be abnormal. And then some people can have abnormal hemoglobin in their red blood cells. So when the hemoglobin is not like normal structure, it will have an impact on the amount of glucose bound to the hemoglobin, and that will indirectly affect the A1C. So always when somebody is looking at the blood sugars and A1C does not matches the blood sugar readings, we should think outside the box and say, okay, there may be some problem going on over here. Then we need to do further testing to look into the hemoglobin, the red blood cells. And a lot of times you'll be surprised that they have one of these problems which I listed. And that's the reason why A1C is totally not matching the average blood sugar readings or day-to-day blood sugar readings. So here in this slide, it's just A1C, as explained, is average blood sugar readings over the last 3 months. So if you look at the graph A1C, there's a straight line across at 7. Then you look at the blood sugars. So blood sugars, it's not like a static blood sugars throughout the day, depending upon the eating habits, what time they eat. So this is the blood sugars which the patient has done by pricking their finger by a glucose meter. So as you see in the first, like on Sunday, blood sugar was 145. After eating, went up to 165, then 170, later at dinner, bedtime is 155. So this is the one patient at home checks their blood sugars. So we look at the blood sugars profile and A1C to come to a conclusion, okay, their blood sugars, some can be blood sugars too high or low, or somebody can have a more flat line. So we look at both the things and then decide, okay, if this person is in the right control of their diabetes or not. Next slide. So the A1C, as I explained earlier, is the average blood sugar readings. So here it's in this figure, you see that the average A1C, if it's 6, it relates to an average blood sugar of 126 over the last 3 months period. Someone with A1C of 7, that is 154. So as I explained earlier, as per American Diabetes Association guidelines, the A1C should be below 7. That means average blood sugar readings around 154. So one day blood sugars may be lower, one day they may be higher than this range. So then somebody with poor control of diabetes, A1C of 10, that is average blood sugar is 240. So if someone as a patient, your doctor tells you, oh, your A1C is 10. So that gives you an indirect idea. If you haven't been checking your blood sugars at home, it gives you an idea that over the last 3 months, my average blood sugar readings are in 240s range. So that's how it helps to determine how your blood sugars are doing on a day-to-day basis, average readings, and that's what your A1C is. Next one. So why we talk about the A1C? I mean, A1C has been shown in numerous studies that higher the A1C, higher the risk of developing the complications. Now, diabetes can affect almost every part of the body from head to toe. The more common complications we see is the microvascular complication. These are called affecting the eyes, affecting the kidneys and the nerves. Then there are another condition is called macrovascular. The larger blood vessels are affected, which leads to heart attack, stroke, poor circulation in the legs, blockages in the arteries in the neck, and later on can lead to stroke. So this is the macrovascular disease. So studies have shown that if blood sugars are running high, you have much higher risk of developing these complications. And then numerous studies have shown, actually, if you can go back, that if you lower the A1C, does it make a difference or not? So this was the study called the UKPDS trial showed that for every 1 point drop in A1C, there was 21% reduction in deaths related to diabetes. There was 37% decrease in risk of developing these microvascular complications. So that is the retinopathy, which is eye damage, nephropathy, kidney damage, neuropathy, that's the nerve damage. And then lowering your A1C led to 14% decrease in the risk of myocardial infarction. So that is heart attack. So that's why all the emphasis nowadays is first to know obviously what your A1C is, then quickly put you on medications to start decreasing your A1C so you end up in the long term less prone to these complications. Yes, next slide. So A1C alone does not give you a full picture. So as I explained earlier, A1C is average blood sugar readings. So here there are 3 patients that is depicted over here on these graphs. So the first one on your extreme left is the person where A1C is 7. And the most of the readings, if you see, that is within the target range of 70 to 180s range. So that's why it's the 100% of the readings they are saying is in range. Second person in the middle, A1C is still 7%, but as you see, the blood sugars are fluctuating quite a bit. Now in this person, 70% of the readings are in target range and 25% of the readings are above 180s, and then 5% are actually below the 70 milligram per deciliter range. Then in the third one is the A1C still 7, but they have wide fluctuation in the blood sugars. Now they have only 40% of the readings are in green zone, and the red zone, which is low blood sugars, is 20%. So this person is at very, very high risk for severe hypoglycemia, can pass out. So just don't look at just A1C. A1C, if this person, we do not show you their graphs, how their blood sugars are, all 3 come with the same report, 7.0 on their lab slip, you will tell all three people, oh, you're doing wonderful. But only wonderful person is the one on the extreme left, the first one. The second one is not bad, but can be better. but the last person is really doing bad with such high, like a low blood sugar readings and then very high blood sugar readings. This is the person who is at high risk for heart attacks, stroke, and other problems. So this person needs immediate attention. So in addition to A1C, that's why we emphasize on the patient to check their blood sugars on a daily basis. So your provider has more information in front of them and then can make the best decision in terms of which medication to use, what type of insulin to use, and help bring your blood sugars within range and make you like the extreme left person with 100% of the readings within target range, which is anywhere from 70 to 180s range. Next slide. So A1C is important, but looking at the blood sugar readings, if somebody has a glucose meter, one should check their readings randomly here and there and provide that information to your providers. So that will go a long way in helping them to find out what's going on. Or if the insurance covers, if persons are on insulin, then the insurance can cover the continuous glucose sensor, and that can even more insight into their blood sugar readings. I mean, these glucose meter give you readings every minute by minute. It can tell you what your blood sugars are. So then it can nicely make a graph and see what your overall glucose profile is, and then the further changes can be made. So this is very, very important for a person, for a provider to have a clear picture. I always give an example of like going to a movie where one time you go to a movie and just watch the start and the end of the movie, and then you are asked to join the dots and make a story. Okay, what's going on? What went through the movie? Other person goes to the movie and we tell them, okay, go every 15 minutes and we'll pull you out. And now you try to connect the dots and try to figure out what's going on. And the third scenario will be the person sits in the movie for full 2 hours, and that person will have a whole story. So this is the exact scenario where by continuous glucose sensor, you can minute to minute, your blood sugars are graphed, and you can tell how your blood sugars have gone up and down in response to the meal, in response to exercise, and you can make healthy decisions, and that can lead to healthy outcomes in the long term. So I think that was the last slide for me. Thank you.
So I'm going to kind of piggyback on what Dr. Hundal spoke about, and to his point, the more familiar we are with blood glucose levels and the patterns that we see, that's very key to successful blood sugar management, because we see, how things relate to perhaps how blood sugars are vacillating. And there are many things that can affect blood sugar levels to varying degrees. We do know that, certain medications sometimes can affect blood sugar levels, illness, stress levels, exercise or lack of exercise, sleep patterns, and of course, what I'm going to be focusing and talking about today are like how food and beverages can affect blood glucose levels. So this first slide, this graphic really does show the power of when we combine different types of foods together, we can greatly affect sometimes the vacillation of our blood sugar levels. And this can then obviously help us figure out patterns that keep us more frequently in that normal level. So let's look at this kind of line by line for a minute. So if we focus on that red line, that you can see when a carbohydrate is eaten, that is a very simple carbohydrate, and we're going to go more into what I mean by simple carbohydrate, et cetera, in the next few slides. But here we have a carbohydrate that doesn't have a lot of fiber, which means that it's broken down very quickly in the body. When it gets into the stomach, it doesn't take much time to break down, absorb, and those the carbohydrates are going into the blood very quickly, and you see that red line shoot up really high. But because it was broken down very quickly, we also get that crash and that significant downward slope, which then, of course, can contribute to those highs and lows that Dr. Hundal was talking about that we want to try to avoid as much as possible. So how do we avoid that effect when we're eating? And that's where adding in specifically foods like protein, fats, and fiber can help move that curve into more of the ideal, what we call the bell curve. You know, that slight slope up, which means blood sugar rises to in response to the foods we're eating, but not spike, and then takes a while to digest. So we have a slower decline of blood sugars and hopefully avoiding the hypoglycemia, the lows, etc. So you can see here, the second line, that gray line, they added a protein to that carbohydrate. And so you see that the highs are going up a little slower and the lows are coming down a little lower. And then you can just follow this progression. They've added a fat. Now, again, we also want to pay attention to lots of other systems in our body. So the more we can add in fats that are more heart healthy, which in general would be eating more fats coming from the unsaturated food sources. So for example, here they talked about adding some pumpkin seeds in, which would be higher in the unsaturated fats than more so than the saturated fat content. And then in this last slide, they added in just, you know, a bit of volume, but also some more fiber as well. So, because you've got the fiber in the strawberries as well as some of the carbohydrates, but you've paired it with some of the healthy fats and the proteins coming from the yogurt. So again, kind of that perfect marriage of different nutrients creating a slow rise and a slow fall. So let's go into a little bit of basics. What are carbohydrates? So they come in three forms. As you can see, I've got them listed here. So we're going to talk about kind of what role these different types of carbohydrates play and where they're found. I think a lot of the times when we think about carbohydrates in regards to foods, we think about more of the starch component, the breads, the pastas, things like that. And indeed, they are a form of carbohydrates specifically because of their starch content, but then sometimes they also might, depending on the food product, they might have some added sugar as well. Because like, for example, in bread, you've got the starch that comes from the grain that is used to make the bread, but you've also often got a little bit of sugar that's been added as well. But there are other sources of starchy foods. Some people know that, you know, if they ate an entire plate of mashed potatoes at a time, likely their blood sugars would go up. Well, there's no added sugar in that potato, but that rise in blood sugar is coming from the starch, and it converts into glucose into the blood. So if we go to the other side, the sugars. When we're talking about sugars, we tend to kind of think about them in two forms, a simple sugar or a complex sugar. And a simple sugar, it basically means it's broken down into its individual molecules of sugar, 1 to 2 molecules long. So things like fructose and glucose, glucose and lactose, and those kinds of the sugars in that little tiny form absorb really quickly, and then can of course raise blood sugars very quickly. And there's benefits to these, because at times, especially if I have patients that has a lot of low blood sugars, if they're having a low, their blood sugars 70 and 69 and getting into the 50s. I want them to have some quick acting glucose or sugar right away to start to get their blood sugars up. But we just talk about how to get some in, but maybe not too much in at a time in order to avoid a major spike. So the complex sugars are larger molecules. So those individual ones linked together. And because those are longer molecules, they tend to take a little longer for the body to break down, therefore releasing those sugars a little slower into the bloodstream and not raising blood sugars as fast. So those might be the carbohydrates, the sugar that we will find in things like beans and fruit and certain veggies and more whole grains. So speaking of grains and whole grains, that brings me to that middle carbohydrate, and that's your fiber. So fiber has many benefits to the body, and we're not actually going to spend too long. I could do a whole presentation on the importance of fiber and the roles that it plays in our health. But again, as you saw in that slide before, when we add fiber, a high fiber into a meal, it takes longer for the body to break down, and therefore we create usually less of a steep spike. So to put this into play, if I ate a slice of Wonder Bread and tracked my blood sugar levels, not a lot of fiber, or probably hardly any fiber in a piece of Wonder Bread. So my blood sugar is going to go up pretty fast. If I ate a slice of 100% whole wheat bread, I would expect my blood sugar to go up, but not quite as fast because of the fiber content, because the whole wheat is when they process the wheat grain, they also keep in the outer fibrous parts of that grain as opposed to taking them off to only get that middle portion of the grain, which is usually used in the white bread. So I just thought this was kind of a good simple graphic of what's going on in the body when that food travels down our esophagus and into our stomachs. So again, you see here in that first graphic there, the reference to the simple sugar. So the body has to pull apart, especially if it's a longer chain sugar, it's got to pull all those apart into one or two glucose molecules so that it can be absorbed into the body. If it's a simple sugar that went in down, if it's a piece of candy, for example, like a butterscotch, when it goes into the blood, there's really no long chain to be broken down. It's just made of simple sugar, so it's going to absorb more quickly. So it goes into the bloodstream, as you can see in the second picture here. Then once the sugar is in the bloodstream, then insulin, there's two kind of hormones that work to help regulate our blood sugar levels, especially in people that still have a working pancreas. So we have your insulin and your glucagon. This is kind of the door, open the door shut kind of hormones. So insulin's job is to go get those sugar molecules in the blood and take them to a cell and say, here you go. Because we want to have, again, not a very high blood sugar level. So, and then the cells take it in. Now, if we're not using that energy really quickly, then we will end up storing some of that as extra fuel for later on, and that usually is in the form of fat. I advanced myself a little too quickly here. I did want to make one other point, and that was that that the carbohydrates are a very important part of our daily consumption. It's just that we want to try to find the area of balance where, again, we're not having way high blood sugar levels and too low blood sugar levels. But carbohydrates are the main source of fuel, for example, for our brain and our nervous system and muscles as well. So, all right, and I did something here. I was quite creative. Let's see if I can get that away here. Okay. All right, I keep advancing. No, it's not what I want to do. I want to go back. There we go. All righty. So why is it important to pay attention to when we eat, because it's a combination of what we eat, when we eat, and then how much. And then we're going to get to the how much in the next coming slides. But what we can see that will happen in the body is if we go for long periods of time without eating, we're going to see those blood sugar levels drop, and the body goes into a mode where it's trying to tell us you need to eat. So you might experience some of the symptoms that I've listed here as your body trying to inwardly yell at you to put some food into it so you don't experience hypoglycemia. So I often work with patients to make sure that they're paying attention to getting something in their body in the morning hours, in the afternoon hours, and in the evening hours. And then depending on what blood sugar levels are doing, as well as what their hunger signals are, we might have to put a healthy snack in between there. Or even sometimes a snack after dinner in order to avoid low blood sugars overnight. But again, back to that very first slide we looked at, the combination of foods are pretty important of what you're eating any time of the day. And we're going to talk about that next. All right, so you saw this slide earlier because I advanced a little too fast. So I find the way to approach kind of putting together a balanced meal is just kind of to go through the categories and decide what category, what kind of food you want to fill into that slot. So one of the main components of trying to have more normal blood sugar levels is a lot of the times avoiding just eating a carbohydrate source by itself, as that first slide pointed out. So protein tends to be one of the big go-tos to help manage, to keep blood sugars from spiking. So here you can just see for an assortment for breakfast protein ideas that people might choose. And then you start to layer on, okay, why don't I include a fat? And as we talked about earlier, doing more of the fats from your unsaturated fat sources. So the olive oils, the avocados, you know, having a salad with a little bit of dressing on it, because you get the fats through there. So, you know, make a good avocado and vinegar dressing, or a good oil and vinegar dressing, or and then the bottom three of this particular side are your carbohydrates. And again, you want to kind of layer those on, and then as you track your blood sugar numbers, one of the beauties of those continuous glucose monitors is you can literally, if you keep for a while like a food journal along with looking at your continuous blood glucose monitor, you can start to kind of figure out patterns of how specific food combinations work in your body. Because we are all such unique beings. My body would have a certain, it would react with a certain level to if I ate a banana, but maybe Donna's body, if she ate that same banana, might act very differently. So it's always very helpful when you can pair together your knowledge of what you've been eating and what your blood sugars are doing. Then you can start to make more informed decisions about the meals and snacks that you're having. And again, another very simple approach that I work with patients on, and I tell them, honestly, this is what I use in my head most of the time when I'm putting together my meals, because it's just so simple. And I just think, you know, when I pack up lunch the night before, or at least think about what I'm packing up for lunch the night before, I just ask myself, what's my protein going to be? You know, what do I have on hand? What's prepared? What's easy? What's quick? Then I ask myself, what's my vegetable going to be? And then what's my carbohydrate going to be? And thinking about kind of in general, consuming them in this kind of percentage or proportions, because this tends to, for many people, be a pretty good balance that can maybe keep people in that normal range more often. So I want to spend just a couple more minutes on this slide. I remember in one of the other talks that I gave for United Medical, a question was asked of, hey, if you had to give some advice as a dietitian, what would that one bit of advice be? And I was like, gosh, that's asking a lot for a dietitian to give you just one bit of advice. But I boiled it down to eat more plants. We all know vegetables are especially are very, very good sources of vitamins and minerals, but the fiber content that they contribute to a meal is wonderful. And it's a way to bulk up our meal, have more food. If you've got a large appetite, you can still eat a good portion of food, but if it's coming from a lot of the vegetables, you're less likely to see the blood sugars spiking from, again, eating like that entire plate of mashed potatoes. The other thing is, if we look at your carbohydrates, and so here it looks like they've got some brown rice, parsley, and honestly, I don't know if that's like sliced mango or in there, but I encourage people to experiment with their grains. Nothing wrong with occasionally having a little bit of white rice, especially if you're also eating it with a healthy protein and a lot of veggies. But how can we incorporate more of the whole grains in as well? So there are so many grains out there to try, and some of them just have absolutely lovely taste profiles. So things like farro and amaranth and teff and barley, or using chickpeas maybe instead of using rice, or using lentils or quinoa. So and then back one little note about the vegetables and getting more in. It doesn't necessarily mean that you have to have half a plate covered in the vegetables. You can actually incorporate the vegetables into the dish. So if you're gonna have chili, throw in some riced cauliflower, throw in a bag of frozen green beans as well, and just eat that in a, it'll just kind of meld with the other tastes around it, but you've increased your vegetable consumption and your fiber consumption by doing that. All right, 2 more slides before I conclude. I just thought it might be interesting to kind of compare 2 typical, like, just breakfast foods and relate this back to our very first slide when we looked at blood sugar levels. So here we've got basically like a croissant that you can see if you look at the blood sugar graph. Blood sugar is going up pretty fast and steep, and then also coming down pretty fast. When we think about why that might be happening, well, typically in this kind of breakfast food, they're using a highly processed flour that the outer part, the bran part, has been stripped. So you're only getting the middle starchy part, the endosperm, which breaks down very quickly in the stomach. And then there's sugar added to it, probably for a nice sweet glaze. And then it looks like there might be some sugar coming from some raisins on there. So again, broken down more quickly in the body. Going down to the image below. All right, so here we still have carbohydrate. We've got some bread, but we've layered on some fats, and again, the avocado having a lot more of the unsaturated, more heart-healthy fats. So this is going to take longer for the stomach to break down, even though there's a slice of bread in there. It's also got that fat content in there that takes longer to digest. So those 2 competing things mean the starch in that bread is going to be released into the blood a little bit more on a patterned basis. So, and the other thing that we could do if we really wanted to kind of add to the blood lowering aspect of this second breakfast is we could maybe decide to make this a slice of whole grain bread. And then there's been some research on sourdough bread, sometimes also not creating as much of a glucose rise. But as we always say, the dose makes the poison. So even if I'm eating a whole wheat bread, if I'm eating 3 slices of it, my blood sugar might go up way too high. So we have to kind of look at how much are we having at a time. All right, last slide here. Just one more kind of taking a look at this additive effect. So piece of bread with some jam. And again, you've got the carbohydrate, the starch in the bread, maybe a little added sugar in the bread, and then you've got the sugar in the fruit, the natural fruit. So there's some probably more complex carb in that jam, but then there's also added sugar. So there's some simple sugar in there. So you've got kind of two carb sources together, and we would expect blood sugars to go up pretty fast and then go down pretty fast. When you add instead a fat to that, where you're putting in some sort of like nut butter that has a little bit of fiber, but also a little bit of protein and some fats, we will see a slower rise. Now, and I tell people, I'm like, nothing, depending on how your individual body reacts, maybe you can put a little of that jam on top of this almond butter. But if you also have the almond butter, maybe you don't have to use as much. Like I love to do peanut butter on bread, and then I just love just putting blueberries, smush it into that, and have that be my sweetness added to there. All right, I think that brings me to the end of my contribution today. So I'll let you two, Donna and Kemal, take over. Oh, we can't hear you, Kemal.
So sorry, I'm not used to being on mute, so but thank you so much for the presentation, Dr. Hundal. Thank you also. Knowing your diabetes numbers like A1C, fasting blood glucose, and blood pressure, these are vital for our chronic care management. And the important thing is the preventing the complications. So these numbers are helpful to get a good snapshot of how our body is processing sugar, and can help us to identify certain issues and complications. So the most important thing from my side is to make sure that when you have these issues, this for our patients, please reach out to your primary care, and then they would put you in touch with our dietitians, our endocrinologists. So this is something that requires multi specialty approach, where we work with the specialist as well as our dietitians. We have 5 full-time dietitians on board with us, and I think we are lucky from that point, because not every practice in Delaware has that type of support. So I always say this, but every time I listen to these, we pick up new information. So it always happens, especially with Dr. Hundal. So thank you for joining us again. And Donna, if you would like to add anything.
I just wanted to say one thing that I found very interesting. Dr. Hundal, and I think we know this, but just seeing it depicted that way, knowing your A1C is 7 does not mean 7 is 7 is 7. I think that's really important, and it ties in very nicely with what Beth said. You need to know the information behind there. So not just getting a blood reading once every 3 months, but doing your blood test throughout the day, and being mindful and tracking what you're eating and how that is impacting it. So I think that that's very important for patients. And that may be why you feel differently than someone else does if you're having a lot of those high spikes and a lot of the low spikes as well in there. So that may be why you're feeling not so well, but thinking that my blood sugar is fine.
Yeah, I mean, that is called reactive hypoglycemia. So we see a lot of patients coming to office for that evaluation, that I'm feeling lousy all the time, sleepy after my meals, foggy brain. So when you do more in-depth evaluation, these are people who are eating foods like Beth explained, and then they are having that low blood sugars 2 hours after a meal, which causes all these symptoms. So basically sending them to a dietitian and changing their diet solves most of the problems.
Right, and teaching them how to pair those things together.
Right.
So, and I just want to say one quick thing. I know Beth and the other dietitians say this all the time. It doesn't mean you can't have the things you like. You just have to learn when to have them, how much, and what to pair them with. So that is what they do an excellent job at with the patients.
Right. Well, again, thank you, everyone. So we'll be back with our Bariatric Friday session in 10 minutes. Dr. Erkan will be joining us, and we'll have another diabetes wellness webinar in the next couple of weeks. Thanks again.
Thank you.
Take care. Thanks.